graduate of De La Salle University and accomplished traditional Chinese medicine education at Beijing University of Chinese Medicine, China Academy of Chinese Medicine Science, and China Moxibustion Institute. Without further ado, let us give a warm round of applause to our guest speaker, Jeffrey Chua Chi. Magbasa kayo, ha?
Okay, maraming salamat sa inyo for inviting me to this event. At magandang gabi po sa inyong lahat. Thank you also very much for the brief introduction. Ang topic natin for tonight is comprehensive traditional Chinese medicine treatment methods for knee osteoarthritis. Ano ibig sabihin ng comprehensive dito? It means to say, we use sophisticated methods to reach the optimum effects. Parang invest tayo sa insurance policy natin, no? Ito sa sasakyan, comprehensive thinking. Okay, before we start, okay, let's go to the background information and the problems we are facing in the medical world today. Okay? According to an authoritative survey, okay, from China, it is estimated that 400 million people worldwide nowadays, okay, are suffering from rheumatic diseases, or tawag natin arthritis. Okay? Arthritis are diseases that are related to joint pain. Tawag natin sa Tagalog, sakit ng mga kasu-kasuan. And according to survey, sa Asia, 1 out of 6 persons may problema ng arthritis. So it's a great number. Okay? Then sa China alone, the figure shown here is very conservative. And it's taken during a report since 2015. Sa China ngayon, there is, during 2015, the figure was 120 million Chinese people having arthritis problem. And the latest figure I got last year is already 200 million. But let's go for the conservative figure. And sa United States, and this is their official figure collected since 2015, there are 54.4 million adults and 300 children. So, tawag nila juvenile. No? Hindi lang matanda ang may ganitong sakit, pati bata. And ang projection nila, when reached 2020, siguro will reach 60 million. And then we will go further to 78 million when reach 2040. Dito sa atin, sa Pilipinas, based on the report from Philippine Star, the figure was, okay, since 2007 pa dito, no? It was more than 5 million. Pero I'm sure, mas malataas pa itong figure na. And when we say arthritis, there are more than 100 types of it. And knee osteoarthritis is the most common, which will cause disability. Okay? Magiging cripple ang isang tao. So, based on statistics, sino ang mas madali makakaroon ng osteoarthritis? Babae, kababaihan. Especially when they are in their menopausal stage. Then, of course, it is likely more than lalaki. And the ratio I have in my clinic is also 3:1. Sa 4 na tao, 3 ang pasyente na babae at 1 ang lalaki. And Figures from studies also shows that the prevalence rate sa mga edad na nasa grupo ng 60 and up, ang percentage is 50%. And sa 75 years old and up, it is 80%. Okay? A very, very big figure. Then, according to Western medicine, there's no cure. Okay? Pero ang problema naman, there are treatment methods. But these treatment methods that are available could not provide safe solution. Only temporary relief lang. And ang mas higit pa dyan, it will lead you to have side effects which will threaten your life. In United States and also Canada, the fourth leading cause of death is adverse drugs reaction. Ano ba yung adverse drugs reaction? These are side effects we get from taking drugs. You may aware if you are in the pharmaceutical industry, sa 2004, there was a scandal, the Vioxx scandal. This was a medicine for pain killer, to release pain. Pero ano nangyari? It leads to 60,000 individuals na namatay. Without that, we go much further. According to World Health Organization, there was a statement, previously, ang sabi nila, 1/3 of the world patients worldwide who die each year is not due to the cause of their disease, but due to wrong drug administration. So our country right now is also facing the decoction. And ano ibig sabihin ang osteoarthritis? According to Western medicine, this is a degenerative disease. That's due to wear and tear, and it will cause your cartilage to become damaged. And ito din ay maaari mangyari pagkatapos ng traumatic injury. So these are the two causes of having osteoarthritis. And according to Western medicine, it's not easy to get healed, through oral administration. Dahil bakit? If through oral administration, we need our blood vessels to bring those medicine to the problem area. Pero doon sa knee joint natin, ang cartilage natin, it lacks blood vessels. So, hindi makakadala doon yung gamot hanggang knee natin. So, it's useless. You keep on taking medicine just only for temporary relief. It holds your pain message to your brain, but it won't heal your problem. And, so, it is the synovium or the synovial membrane who is giving and producing natural fluid to nourish our knee to give lubrication. So, kaya yung mga method ginagawa, they inject hyaluronic acid sa knee natin. Then according to traditional Chinese methods and medicine, ito po ay isang B syndrome. B is a Chinese word. We pronounce it in English. Ang ibig sabihin ng B is obstruction. So it's an obstruction due to invasion of external pathogens such as wind, cold, dampness. Then when it penetrates to the problem area, it will cause stagnation. And when there's stagnation, it will hinder the normal flow of qi and blood. And that's according to the Chinese medical theory. So another one is, it is also classified as bone impediment. What does it mean? It is weakness of the bone. Dahil bakit? Tumatanda na. This is due to deficiency of the liver and kidney functions. Why we say liver and kidney function? Because in traditional Chinese medicine, It is the liver that is in charge of our tendons and ligaments. And it is the kidney that's in charge of our bone. Okay? So if you want to have a stronger bone, you must know how to improve your kidney function. Okay, and then what are the symptoms and how it flows, no? Una-una, pag nakaroon tayo ng osteoarthritis, the first symptom is soreness and stiffness. When we say stiffness, it's tightness. Then if you have tightness of the muscles and ligaments, nakakonstrict ang knee natin. Kumikipit ang joint space. So, laging sinasabi sa X-ray, narrowing of your knee joint. And so, pag nag-narrowing, then malapit na ang distance ng joint space natin. So, if you move, if you walk, then you have to stretch it, okay? You have to bend it. Kaya, nag-iskis na nag-iskis, so nadadamage na ang mga cartilages. And if keep on having this grinding, then minsan pag weak ang kidney natin, then magiging weak ang bone natin, di magkakaroon ng chipping. Okay? So if there's chipping, parang skin din natin, pag nahiwa, syempre it will repair, okay, through our immune system. Pero ang nangyari, hindi na smooth, nagiging keloid. Ganun din ang buto natin. No? May recover na, kaso lang, hindi na ganun smooth. Kasi kaya makakaroon ng bone sphere. So, osteophytes, pag nabasa ninyo doon sa mga x-ray report, ang tawag nila osteophytes. No? And also, pag giskis na giskis, magiging deform ang knee natin. Pero once na na-deform, hindi na makakabalik sa dating anyo. And also, another symptom is numbness and heaviness. Nagiging numbness dahil may stagnation doon, no? Due to cause of the external pathogens, then it will cause insufficient of Qi and blood supply. If a certain area of a body is insufficient of Qi and blood supply, when we say Qi, it's the energy. Or some people may explain it as oxygen. But in Chinese medicine, Qi has a broader meaning. So if you have insufficient of blood and oxygen flow, that area will become numbness. Yun ang dahilan. Dahil hindi makakatalog yung mga dugo natin. And also, pag tumatagal ang mga stagnation, parang traffic, no? Yung tipo hindi rin makakadaan na maayos, parang yung sasakyan, nata-traffic. So, nakatikit-tikit. Then it will cause what? Blood stasis. O tawag natin, mga blood clot. So, another thing is pain, no? Yun ang katalasan ng nangyayari, no? Dahil na masakit, kaya hindi na natin kaya. So, bakit nakakaroon ng pain? Actually, when there's tightness, this na disease, hindi mo pa alam minsan, ang marinig mo na mga clicking sounds. Pero, pag sumakit na, ano ibig sabihin? Okay? Yung mga soft tissues mo, nabanat. Mga tendons mo, nabanat na. So, that's the main cause of the pain. Then, is it really true that it is not curable ang osteoarthritis? Our answer sa amin is no. It's not just only treatable, but it is also curable through traditional Chinese medicine methods. Okay, ano po yung traditional Chinese medicine? Okay, it is the study of human physiology and pathology that is dealing with diagnosis, prevention, and treatment of diseases. So when we say physiology, is study of the body parts and its function. And when we say pathology, is the study of the nature, origin, progress, and cause of diseases. It sounds like parang nasa Western medicine definition, no? Almost the same. Pero, ano ang kaibahan nila? According to the State Ministry of Science and Technology, okay, of their terminology committee, ang kaibahan ng Western medicine sa Chinese medicine is mainly based on two aspects. Una is based on Chinese medical theories. And second, okay, it is a practical experience. We learn from our ancestors. And ang traditional Chinese medicine, okay, it is also considered as a cultural heritage. When we say cultural heritage, it is the way of mga life ng mga Chinese people, okay, which has a history of more than 5,000 years. Kung gaano tagal ng Chinese civilization, gaano katagal din ang traditional Chinese medicine. And today, this TCM is also supported with unearthed artifacts and literature of more than 3,000 years. Okay, and when we say traditional Chinese medicine, maybe you have in your mind na, okay, mga lumang gawain niya. Okay, it's very ancient, very old. No, I tell you, it's not. Okay, in fact, in Chinese medicine, okay, it is evolving. Okay, nag-improve yan. So today we have the so-called modernization of Chinese medicine under the tireless support from the Chinese Communist Party. Okay, they give both equal importance to Western medicine and also Chinese medicine. That's why we have the integration today, okay, in the medical world. So clinical researches, okay, are being done in government hospital and also research institutions that are now considered as scientifically evidence-based na rin. Hindi katulad ng yung naata. Kasi ang Chinese medicine, it's a pseudoscience. But actually, walang alam sila. No? Hindi nila alam kung anong ginagawa ang traditional Chinese medicine, okay, papunta doon sa modern traditional Chinese medicine. Okay. In fact, for those who had been to China, and you will notice that some of the government institutions related to traditional Chinese medicine have changed their name. And one of it is the institution where I come from. Okay, it is called China Academy of Traditional Chinese Medicine dati, and it has changed now to China Academy of Chinese Medical Sciences, which is representing the state. And sinasabi natin is based on traditional Chinese medical theories, and one of the theory which we often explain to the public is the meridians and acupuncture theory, which cannot be proven through anatomy. Okay, and what is this? According to traditional Chinese medicine, our body is made up of a complex network of system with organs that are connected by pathway for qi and blood flow. And recent studies, scientists have confirmed that the meridians are low resistance fluid channels where various chemical and physical transport take place. Itong nakaraang pa lang, nakarinig ako sa a TV station from Hong Kong, Fenghuang Weisihai, and they reported that ngayon, there is a report na na-confirm na meron talaga ang existence ng these meridians. And along these meridians, may mga acupoints. Doon din namin tinutusok ang karayom. No? These are located on the surface area of a skin. And dati pa, no, the institution is called Shanghai Normal College. The scientists from there, they have discovered that doon sa acupoints area, in comparison with non-acupoints area, mas okay, mataas, no, ang density ng microvessels doon sa acupoints. So, ano ibig sabihin yan, no? Pag you study biology, meron sinasabi na itong mitochondria. Ano ba yung mitochondria? These are the energy powerhouse na sa cells natin. Okay? And they found out that mas marami doon sa acupoints area. So, ibig sabihin, more power can be produced by using external applications to stimulate it. And may mga characteristic ang acupoints, no? It's also low in resistance, pero okay, it's susceptible to larger volume of stimulation from external forces, such as applying the acupuncture, and also to sound effect. And another one is it is very sensitive to heat influence, no? But it's not ordinary heat, but heat from herbal medicine, which I'll give you in detail later on. So this is a picture of a meridian. We call that liver meridian. You can see the red line flow from the toe up, going up. So ito ang isang meridians na sa katawan natin. Okay, out of those 12 regular meridians and 8 extra meridians. Then, what we are doing in TCM is, okay, before we go to the treatment proper, of course, we have to do diagnostic. Okay? Titignan natin kung ano talaga ang problema ng isang tao. So, the for basic diagnostic method first is observation by looking. Okay? Then next is listening and smelling. And of course, questioning is very important, especially you have to understand and have the knowledge about their background history. And also, we do the pulse reading and palpation, okay, to know the characteristic of the body. And okay, for those patients who have osteoarthritis problem, kadalasan dadala sila ng mga X-ray nila and MRI for our additional input. So, in musculoskeletal problem, okay, ang pinaka-importante dyan is the practitioner should know very well how to do palpation. Okay? Kailangan madun sila makapa. Kung saan talaga ang main area ng where are the problem areas, and enable to know where you're going to apply your treatment. So a TCM practitioner who perform this must be very sensitive ang mga kamay nila. Okay? Then there is the teaching in TCM when it comes to treatment of musculoskeletal problem. It states like this: to treat skeletal problem, must first treat the tendons and ligaments. If tightened tendons and ligaments are released, then bone will be back to its proper alignment. And to regulate the meridian, must first treat the muscles. If muscles are becoming softened, then obstruction in the meridians will then be eliminated. And we always follow this rule when it comes to doing treatment for musculoskeletal problem. So we have to release it first. So hindi katulad yung chiropractor, kahit na matikas pa, pinipilit makracking. So kaya minsan, marami tumatakbo sa emergency. Okay. So what we do is, we often first apply the Tuina. Ano ba yung Tuina? Tuina is Chinese medical massage. Okay? It is a clinical specialty, and the performer must have the skill. Okay? They use their elbow or their hand, okay, to apply it on certain part of the body to regulate, in order to regulate the meridians. Then, we also often aided it with Guasha. Ang Guasha is a apparatus, okay, with round-edged side, then kinukuskus namin sa labas. Then minsan after that, you will see those PITAHC elevated from your skin. And these are the tawag nila, no, pathogenic waste, or sometimes it's also known as metabolic waste sa katawan natin, which cannot just release out from the body through defecation, respiration, or urination. Then, pag napasok na sa katawan, binubustos mo, lumalabas agad. So, makaka-flow na maayos yung mga meridians natin. And also, we have Ventosa application. Ventosa is also known as cupping. Makikita ninyo minsan sa mga pictures o mga, well, maybe yung sine, no? May application ng Ventosa. So, after that, pag inalis mo, okay, may mga marks. Kaya ito din ako ay tawag natin PITAHC. Same as scraping. So, what we do is, so, in order to first eliminate those pathogens on the superficial area, hindi sa loob ng katawan. Yung mga napasukan naman nandyan pa sa shallow superficial area of our body. Okay, this is what we do in Tuina. No? That was a patient with the osteoarthritis problem, and we do the herbal manipulating technique to release first the okay, that before that is the release the quadriceps nasa likod. And this one, no, pag may osteoarthritis, nakikita mo, yung dito inner nila makapal. No, tawag namin, Diyos no specific term English, ang ginagawa ko, ang pinapangalan ko, inner canal. No, dahil nabarado na yung canal dito. Okay, ang ginagawa namin, oil. You don't need to do any herbal ointment there. Ang purpose ng oil, okay, is for lubrication, and it makes our hand more sensitive. Iba yung walang oil sa kamay, paghawak mo, okay, pero mati-distinguish mo, pero hindi ganun ka-sensitive. Pag may oil, very sensitive. We were able to detect kung anong characteristic na pathogens nasa katawan niya. Whether ito ba ay mas dominate ang dampness, o lamig, o hangin. So, with the help of the oil, ma-sensitive ang kamay namin. Of course, yes, okay, but as long as it's madulas. Sometimes, minsan nga, in a restaurant, kahit ng mga langis sa mga pagkain namin, minsan may mga cases na kailangan namin ginagamit namin yung langis ng mga tira-tira dun sa pagkain natin. Yes, baby. Yeah. Okay, so that was Tuina, no, for the first application. But hindi takot sa karal yung mga pasyente namin. Then we will convince them to have acupuncture. Okay? Kasi hindi lahat ng tao yung takot din, no? Hindi din lahat ng tao na hindi takot. So, pag ganito, usually we will convince them. We will give them a good impression kung talaga ano ang acupuncture. Kaya ano nangyayari ngayon? Kasi yung iba, no, kahit na hindi pa masyadong marunong, nag-perform ng acupuncture. Then, ang mga patients na walang previous experience, then, napatrip. So, na-input na sa mind nila, ay, ang sakit magpa-acupuncture pala. Pag marunong, if you are really a trained practitioner, pag tusok namin dyan, hindi masakit. That depends on how good a acupuncturist is. Today you will see those acupuncture, they're using tight tubes. But in China, you will see an expert doing tight tube. Freehand technique lahat. Kasi that's how you, okay, and how the disease effectiveness, mas effectiveness, but you use freehand technique. You can apply the technique on the patient, okay, on the problem area. So acupuncture is not just only inserting of very fine stainless sterilized needle on certain area of the body, or we call that acupuncture to correct illnesses. Okay, so as what I told you about, the practitioner must have finger strength. Okay, so with this finger strength, you can hit the acupoints with force transfer from your hand deep into the acupoint to explode the circulation, enable the oxygen and blood to flow. Okay, that's the main purpose of acupuncture. Okay, this is how I perform acupuncture. Okay, before we do the acupuncture, we first sterilize the area which we are going to insert. Some use alcohol, okay, use a cotton with alcohol. Others they might use this decoction to clean it. Yes. Okay. First, okay, I look for the area where to insert. Then this is a double needle technique. Hindi lang isang karayo ang natusukan dyan. You will see double needle sabay. Okay. So, how do you know how expert ang acupuncture is? Makikita niyo sa needle insertion. Hindi kahit saan tinutusok. You have to diagnose first where are the areas supposedly na kayo ang tutusok. Usually, to train an acupuncturist to become expert or magiging master, it takes usually 15 to 20 years. Hindi lang yung go for just only few months of training, then yun na. No? It takes a lot of time. And depende din kung sino ang guru mo. So, after acupuncture, okay, it's not yet done. We often will recommend for those who have osteoarthritis to put a pain patch called Chinese Moxibustion. Okay? Because we do not do traditional Moxibustion at our clinic dahil there are smokes that will be produced and which will give irritation to the patients. Okay? And we have already the advanced one. Why not use the advanced one? And I will tell you the reason why. Okay, we recommend the advanced one. No? So, ito yung tawag namin na Chinese Moxibustion. We will recommend the patients to bring it at home and inform them or introduce them where the area they will put the touch. And this one, you'll see there is a black tablet. It's are composed of 80% Artemisia IEA, which is the main ingredients on traditional Chinese Moxibustion, and another 20% with other herbal ingredients composed of about 20% for relieving pain, alleviating the pain, okay, anti-inflammation or swelling, and improve the tissue to get the pure. And okay, so let me introduce this. What is Moxibustion? Okay, it's an ancient method of healing diseases by igniting a herbal preparation, okay, and apply the heat produced from it on acupoints or certain area of the body, and also meridians, enable to regulate the body system and for the disease to get healed. ATCM, okay, maraming, kahit na mga old professionals, they have limited knowledge on Moxibustion. In fact, there is a professor from the US, nagsabi siya, dahil limited ang turo sa school tungkol sa Moxibustion, unless that person is specially trained. So, in TCM, ang pinakamagaling, okay, ang pinaka-powerful tools, no? Powerful tool is Moxibustion. So, bakit natin sinasabi? May basis tayo. Okay? According to a book called The Fundamental Medicine, which was written since 16th century, noted, when decocted soup and acupuncture are tested and become ineffective, Moxibustion must be applied. And another book says, okay, the book of Essential Teachings by legendary Dr. Piaget. if you are a Chinese, maybe you know this, who is Ventosa? Ventosa is the most famous doctor in all-time history sa China. Okay? Anong sinabi niya? In order to save life, must apply Moxibustion first. So what is the purpose of Moxibustion? It saves lives. Okay? It could help you to preserve your energy. So these are two pictures of traditional Chinese Moxibustion. We have the one on the left, which looks like a tobacco stick. Okay? Yung iba ang ginagawa nila, tinutusok ng karayot, kung ginagay niyan, siguro mga 1 cm na portion, they ignite it. No? And another traditional type is the tawag natin moxacone. No? Same materials, but with a slice of ginger on the bottom in order to prevent from getting burned. Kaya yung iba sinasadya nila, sinasadya na magiging to get burned kasi mas maganda ang effective. Pero nowadays, bihira ng tao na gustong ganun gawin. Oo, nakakaroon ng peklat. Pero mabilis to get well ang problema mo. And okay, kanina na sabi ako, we will introduce to our patients to use the Chinese Moxibustion. In fact, Chinese Moxibustion is not just only a product. Okay, it is a set of world-leading herbal medicine. Okay, that bears the name of the state as its identification. Okay, we have two brands. One is called China Moxibustion, bearing the state name. So it represents what? The state. Okay? And another one for export, we call that Chinese Moxibustion. The government has invested heavily in the research and development of it. Okay? This is not a private project. It's a project of the state. Okay? Under the Ministry of Science and Technology, and they placed it in their SPART program. Okay? So it is considered as what? A national product. Kasing level mga China Aviation, mga ganitong ranko. And this product is, these products are researched and developed by China Moxibustion Institute. Sino ba itong China Moxibustion Institute? It is a state-level institution, also known as Institution of Acupuncture and Moxibustion Institution of China Academy of Chinese Medical Sciences, okay, who was formerly the State Health Department's Archipelago Moxibustion Research Institute or Laboratory, which was established since August 2, 1951. So matagal na nag-research ang mga government institution. Kaya lang, walang alam mga takal sa labas. So, currently, this institution is the most authoritative, prestigious, and biggest national comprehensive institution for science research, clinical medicine, and medical education in China. Dahil, this is under the government, and they are the government. So, aside from that, this institution is also one of the World Health Organization Collaborating Center for Traditional Medicine. So, kanina sinabi ko, sasabihin ko ngayon na kung bakit nag-recommend kami ng itong product, hindi dahil sa it is government project, dahil sa effectiveness niya. No? So, ano ang kaibahan nito sa mga traditional Chinese Moxibustion? Dahil there is a automatic heating element nandyan. Hindi na kailangan isindi. And it's smokiness, and which will not cause irritation to the patients. Okay? And it is very safe to use. So, hindi masusunod. Huh? And because the temperature there, you can control that. Okay? We put a plastic on top of the product, so it will hinder the flow of oxygen inside, so it can use longer and the heat can be lower. Okay? And in fact, we can help the heat with the plastic Okay, the heat will go as high as 42 degree up to 46 degree consistently for 16 hours. And it can go as high as 50 plus degrees Celsius without the plastic. Okay, and last maybe will be shorter in time. And we can do it up to 70 degrees Celsius. Okay, giving you an information, ang mga cancer cells takot sa init na Moxibustion if it is higher than 50 degrees Celsius. Okay, another reason why we recommend that is it's very convenient to use. You need not to go back and forth to the clinic. You can just attach it. No? Tuturuan namin kung saan ito ilalagay. So, there's no time and space constraint. And another reason why is, okay, it is tested na the effectiveness is 20 to 30 times much, okay, higher in effectiveness when compared to traditional Chinese medicine. And another reason is it's very economical. When considering the diseases it can treat. And another, ang pinaka-importante, it's considered as a green medication. Bakit tawag natin green medication? It will not cause you side effects. If ever man, siguro mga allergies sa herbal medicine, may allergy kayo sa herbal medicine, but we have ways to control one. Then, okay, after all this, usually we, as much as possible, won't recommend patients to take decoction dahil makinig lang talaga. Pero for those who have allergy and are sensitive to herbal patch, o yung mga talagang edad na, no, mahina ng talaga katawan, we have to act, okay, one more modality. Irereseta namin ng herbal medicine based on syndrome differentiation and holistic approach. Okay, after all of this, hindi na bahala ka na. We will give advices to the patients. Anong dapat gawin at ano ang hindi dapat gawin. Okay? Lagi namin stress, doing writing at the right time. Okay? Una-una, okay, laging tanong ng pasyente, kailan ako makakaligo pagkatapos ng treatment? Halos lahat ng pasyente natatanong itong question. Ang sabi namin, kasi before, ang turo sa amin ng teacher namin, pwede na after 3 hours. In fact, there are mga writings 30 minutes after, pwede na. Pero, what we had experienced clinically, sinabi namin sa pasyente after 3 hours, tama. Okay? Di ko siya after 3 hours, pero the next time balik niya, okay, mapapal na naman ang dampness. So, we think na hindi kaya ng 3 hours. So, the best is overnight na lang. After sleep, nag-adjust ng mga skin natin, ang mga pores natin will close na. Usually, it takes, for strong, very healthy individual, it might take about 30 minutes, close back na. Pero some people, really, they are very weak. They have a very poor resistance to invasion ng mga external pathogens. So, mas mabuti, after a day na lang. Minsan nga sabihin ng pasyente, ibalik na, another day pa ako. No? And so, we say doing writing at the right time. So, rest ang pinaka-importante. Kasi, it's different. If you have osteoarthritis, ibig sabihin, may injury na yung tuhod mo. So, just like with broken bone, no? Yung iba, sesementohin pa para hindi ka makakagalaw For enable you to have more rest. Same as osteoarthritis. You do not get exercise to improve your condition. So, rest ang pinaka-importante. And prevent from going up and going down the stairs. Dahil, pag nag-up and down, mapapagod lalo ang tuhod natin. Imagine, pag naglalakad ka sa sasakyan, nahihirapan ka na. So, pag umakyat ka na hagdanan, you are bearing times 3 of your weight. Pag bumaba ka na hagdanan, almost 4 times. So, yung mga pasyente nga, lagi namin sinasabi, rest. Minsan na, may mga pasyente nga, pumapasok. Bakit hindi ako gumagaling? No? Paulit-ulit yung problema ko. Tinanong ko, mag-rest ka ba? Hindi. Kasi, bla. No? Dahil anak ko, apo ko, luluto ako, ganun ang reason. Pero sabi ko sa'yo, pag ganun ka, okay lang sa akin, balik na lang. No? Then, okay. So, ang suggestion natin is more rest. Pero, you will notice, pag matagal na nakaupo o nakahiga, pag akit mo, mahigpit. Bakit? Kasi when we are in stagnant, I mean to say stationary stage, no, walang galaw, ang flow ng dugo natin mabagal. Okay? So, ang recommendation namin sa pasyente is galaw ka, pero short range of motion lang. Hindi yung malakas. At saka, pwede mo, you can tap it, konting galaw, for about 5 to 10 minutes before you going up. Para hindi, kasi pag ganito, matigas na, tapos akit mo, banat na naman. So, the healing process will start from the beginning. No? So, yes. Yeah. Okay? Injured knee cannot get healed through exercise. So, pag may knee osteoarthritis ka, then the doctor will tell you, galaw ka na galaw, lakad ka ng lakad. Okay? Squat to strengthen your quadriceps muscles. I am very sure na mali ang turo nila. Through our clinical experience, for we have a lot of patients who get healed through our advices. Okay, let's go to the summary. Although TCM have many effective methods, which I had mentioned several a while ago, but based on our clinical experience, using one method will restrict, okay, its flow. We will suggest to use the comprehensive methods. Actually, osteoarthritis is not difficult to treat. Okay, it is curable. Okay, if you seek the proper treatment. Anong problema talaga ang nangyayari? Dahil maraming mali method of treatments, kaya hindi gumagaling. So if you seek proper treatment, okay, mabilis, okay, will get cured. And minsan yung iba naman, dahil may problem sila, maybe frustrated, so hindi nila alam kung saan dapat ang pupuntahan nila, then tinitiis ng tiniis until na hindi na ganun kadali mag-heal. So ang recommend namin is, okay, seek early treatment. Okay? And kasi pag mali ang treatment ang ginawa sa'yo, it will damage more your knee. So, ang pupuntahan mo, no, to those really have the capability. Laging kung binabanggit sa pasyente. In fact, sa clinic namin, may come to osteoarthritis, may effect na right after the treatment session that day. Pero there are few, hindi. Ay, hindi yung mga tipo no? Kasi may pang tao talaga, mahina ang sensitivity nila. So, ang sinabi ko sa kanila, okay, after the treatment, alam mo na, no, may effectiveness. Okay? Some need several treatments, some just only few, some may take as long as 3 months. Ang sabi sa Chinese medicine, pag nakaroon ng problema ng buto at saka mga tendons, it usually will take 100 days to get cured. Okay? And sabi natin cure dito, no, hindi ibig sabihin na hindi na mangyayari ulit. Dahil it's a degenerative process. So, it's just like having sponge. Okay? Makakaroon ka ng sipon ngayon, pero umaling nga. Pero some other day, makakaroon ka ulit. Ganun din ang osteoarthritis. But I tell them, alam mo na kung saan ka dapat pupuntahan. No? Huwag kahit saan. No? Of course, yung mga friends natin na recommend sila tayo, they have a very good heart to recommend you to certain doctors. But you make sure, okay, pag marunong sila, just only 1 or 2 minutes, you will see the effectiveness. Okay? I actually have prepared some researches, but I don't think we have enough time. So, mas maganda, mag-friend na lang tayo sa Facebook. I just uploaded 2 clinical researches, no? Yung isa ay using Tuina, Okay, for yes, 1 year, once or twice a day, and then see the cartilage recovery using the MRI. Hindi na mga blindfolded, mga sham, mga ano, no, bago na ngayon to do this kind of researches. You have the advanced imaging technique, okay, using the T2 mapping. Makikita mo kung after kanong tagal, no, nag-regrow ang cartilage. It is repairable, okay? And in fact, on that study, 30 patients, after a year, the cartilage grew 58%. And another is using traditional Chinese Moxibustion. They test the presence of hyaluronic acid sa serum and also the synovial fluid na minsan ginagamit yung artificial injection. So the level, it's all there. Okay? Thank you very much sa inviting me to this event. Okay, that's all. Oh, may question kayo? Yes. Sino may question po? Okay, we don't just only treat the osteoarthritis. Okay, we do other musculoskeletal problems. Let's say cervical spondylosis, lumbar protrusion, okay, frozen shoulder. Okay, we are the experts. Lumbar, Baywan, lower back. Pelvic is part of the Baywan, no? So it's included, yes. Lower back, opo. Lower back. Yeah. Yes, almost the same procedures we do. Yes, pagkabot sa acupuncture, sabihin niyo sa akin, no? We don't like to force you to have acupuncture. Hindi naman acupuncture ang pinaka-magaling dyan eh. No?
Tatandaan kayo, no?
Yes.
I am under acupuncture therapy for 2 years.
May what?
Trigeminal.
Okay, Tajin.
So, my doctor is
Okay, Tajin, this problem, it's not easy to heal.
yeah, that is almost good.
Yeah.
So, what I mean is similar because
It's the same, yeah. But, of course, there are differences. Okay? Kasi it is not a musculoskeletal it's on the problem on the nerve.
My question is, if you don't have yet the osteoarthritis, can you prevent it from?
Okay, yes, that was the same question to me from a group. Okay, how to prevent from osteoporosis? Okay, there are so in order to prevent osteoporosis, we have to improve our kidney function. What I said a while ago, kidney is the organ that is in charge of our bone. So we have to improve its function through several kinds of ways. One is through decoction, okay, herbal medicine, but actually we don't advise taking so long the herbal decoction kahit na paano, may certain toxicity. Yeah. So another way is using the Chinese Moxibustion, okay, to put it on your tawag namin, main acupoint, the acupoint at the back of our navel, okay, which is very near to our kidney. Yung tinatapal din na, it helps, okay? But depende din sa tao sa kanyang kung hiyang talaga siya. But there are ways.
So it can you prevent to
Pero ang prevention usually hindi matandaan na tayo saka nagpe-prevent tayo. It should be start with the prevention. Pag sa babae, alam mo, in Chinese medicine, is lang ang magiging age. And sa lalaki, 40. So, before that time, you have to start na.
Mayroon mga 71 na.
Okay. Okay. Pag meron, no, gawain na para maitulong, mas maganda kaysa wala. Di ba? At least meron.
Wala pa naman nararamdaman na eh.
Yeah, so you have to, well, iba sabi, health is better than cure. Okay, prevention is better than cure. No? So, kailangan, in a younger stage, umpisa na ang proper way of living and healthcare.
So, exercise.
Exercise, yes. But sa edad natin, hindi na pwede sobrang strenuous ang exercise. Dahil it will, instead of giving us to have a good health, it might become a burden. So, ang exercise is moderate lang. Hindi pwede yung jogging ka ng ilang kilometers or whatever. Kailangan, basta as long as nagpapawis tayo, konti man, hindi din pwede sobra. No? So, everything should be in the right amount. Moderate lang. My clinic is at Binondo area. It's called Ventosa building, beside Binondo Church, and also in between Taitana and Binondo Church. Sa the office building, 5th floor. Yes, I have.
Sa Condesa. Sa Plaza.
Plaza mismo, facing Plaza.
Tabi ng first.
Yes, tabi ang pasukan, tabi ng Asalay. Okay, my clinic hours is from 8 to 5 o'clock in the afternoon, and our cutoff time is at 3 p.m. Because usually it takes mga 2 hours for a patient.
2 hours?
Yes, even sometimes depende, pag sobrang busy at marami, at saka sobrang severe ang condition, sometimes it will take 3 to 4 hours. Yes.
No scheduling either.
We don't need to have any schedule because we from the start, we do the policy of first come, first serve. Pero pwede naman tumawag na kung sobrang busy ba, maraming pasyente pa, o mas konti. Pero we can assure ka, minsan na tumawag kayo, walang pasyente. Tapos before you come, you arrive, sabay-sabay naman yung nauna. But we still can manage it. Then wala kami sa Thursday and Sunday and holidays. Okay. I'll give you the calling card later. Any other questions? Yes, pero it's not my specialty. My specialty is talaga dun sa mga musculoskeletal problems.
Ito pa magagawa. Ito pa magpana.
We have a product for boosting that problem. Boosting the energy. Yes, strengthening the joint function. One of the products is from China Moxibustion.
Sigurado marami napipila sa clinic na yan next week.
Okay, so
There's a way to know whether you are prone to knee arthritis. Meron bang testing siya?
Okay, sinabi ko kanina, we do the palpation. Yes, pag hinawakan namin through the use of the oil, we can tell you if you have that problem or not. O, kasi yun pa, asymptomatic eh. Walang symptom yung iba. So, I'm able to detect, using that without any x-ray.
Magkano ba yan?
Pag mga detect dito, we don't give much intention in importance to that. Pero ang charge namin, if really need to have the treatment, we charge 1.8 for the first session and 1.5 for the succeeding. And if you don't, I think na you don't need to have the treatment. Okay, you can just only have the decoction or whatever, then hindi ka naman papabayad ng ganito ng presyo. Yes, ma'am? Yes, it is tailor-made. Hindi pwede yung one formula for all who have the same problem. That's the principle in TCM. Okay, you have to do syndrome differentiation. Okay, kasi yung iba ginagawa niya sa inyo, so it's not a professional practice. For example, having the same problem, no? Kahit na same condition, pero sometimes we do plus or minus based on your body condition. So hindi parehas. Sinasadya namin tailored. No, I give you the formula, okay, which is readable, and then you can bring that to any drugstore as you wish. So if you don't know any, then we will give some recommendation. But wala kaming relationship, wala kaming porsyento dyan.
So may question?
Yes, sir.
One of the recommended treatments does this exclude other kinds of pathogens like chaps or spine? Will that complement or?
Okay, ganito. If you know the history of the China Moxibustion on Tuina, okay, this shiatsu, mga Pinoy massage, these are derived from traditional Chinese medicine. Okay, na-influence ang Chinese medicine since the 5th century to them. So, okay, kasi in traditional Chinese medicine, we are based on traditional medicine theory. Sila, nag-iba na ang theory nila. Pero may konting relationship. Pero depende sa practitioner. No? Kahit napunta kayo sa isang naka-granted ng traditional medicine doctor, pero ang skill niya, just the same. O kaya napunta ka sa isang hilot siya, no? Wala siyang alam sa traditional medicine, but he or she has that ability. So, sa tao, sa yung gumagawa. So, hindi pwede naman usually, ang sabi ko sa pasyente, pag may ganitong problem ka, huwag ka nang punta sa mga iba na mga hindi professionals. Okay? Pero kung wala kang sakit, you just want to have relaxation, okay lang. As long as don't request them to do hard. No? Kasi madalas kung ito hard, nakakaroon na ng suicidal problem later on.
Okay, meron pang question?
Yes? Dahil sa tawag natin dyan, weak mind jam. Okay? Vital energy. Okay? Yun. Yun ang weak. So, ang ginagawa naman sa PCM, you use this herbal medicine to boost your young energy.
Kasi pa gumagamit ng bayan,
You must know that has a very great side effects. Baka mamaya, kasali ka dun sa sinasabi ko na reported by World Health Organization.
Okay, meron pa bang questions? So that being the case, let's give a warm applause to Dr. Jeffrey for his wisdom on his field of expertise. Medical President Edison for the token of appreciation. Together with CSBD para mabigay. Sa baba na nasa ulan. Doc, sa baba na lang.
Yes, doctor, may dala ang function ng mga
Kasi hindi na makakit dito si
Okay. Bagong Bayan, Manila. The plaque of appreciation is hereby given to Dr. Jeffrey Chua in grateful recognition for sharing his time and expertise as guest of honor speaker during this club regular meeting. Event is the 5th day of April 2018 at the AG New World Hotel Marina Bay. Signed, Willie T. Chua, Club Secretary, Edison Airoso, Club President.
Thursday, Sunday, tayo holiday.
Thank you, Dr. Jeffrey. May we call GP Edison for give this here in
During the meeting.
Okay, club teacher. Club teacher.
Sa Diyos. Oh, sa akin, di pa. Di pa nag-graduate. Ako.
Isopong eh. Di sito as
Nangyatuwe sa sabi namin.
Isopong di sito as
Oo nga. Picture ko na.